Hey everybody, this is Dr. Hunt Physical Therapy. Today we're going to talk about how to treat plantar fasciitis at home. All these videos we upload, eventually we're going to show you things we do in the clinic. I love to expose the public to the way we practice here at Hunt Physical Therapy, the different the tools and techniques we've acquired over the years to treat these things. But a lot of people want to know what they can do at home for these things. And plantar fasciitis, it can be tough to treat. It can become chronic real easy, and I've had patients in my clinic that have come in here and they've had plantar fasciitis for 6 to 12 months. So it seems like once you get it, it might not go away, but there's things you can do for it. It's a tightening phenomenon. The plantar fascia, it's this large piece of connective tissue, tendon-like tissue on the bottom of the foot, and it inserts on the back of the heel. So a lot of times the pain people have is back here at the inside of the heel bone right there. Symptoms are profound pain. A lot of times, first thing in the morning when you get up, or you've been immobile sitting in a chair, that initial heel contact can be excruciating. And also sometimes the symptoms can refer to the front of the foot. So walking can be painful, particularly walking on unstable surfaces. And so again, it's a tightening phenomenon. We think that what happens is there's some kind of micro trauma, could be wearing heels, could be walking on unstable surface, that there's little bits of trauma which occur over time, which causes fibrosis to occur in the plantar fascia, and it just gets more and more tight, and the pain comes from the pulling of the plantar fascia on the back of the heel. And I've had a case just personally where I literally went to bed fine, and when my foot hit the ground in the morning, the pain was there in the heel. And so I've gotten pretty good at treating this. So like I said, we're going to go over a few things to do at home. Stretch that I like to show my patients is to sit like this. So let's say the plantar fascia pain is on the right heel, is to sit like this with your leg crossed, and then simply take your hand and take like the big toe portion of the foot. Let me turn around so you can see me a little bit better, and flex your foot up like that. I like to do this without the shoe on, and I'm going to show you something you can do with your sock on and a piece of equipment that everybody can get. A lot of people already have it, but if you don't have one, you can get one for like 50, 60 bucks on Amazon. But again, take your foot and flex the heel up like that, and just hold that for 30 to 60 seconds. You can do this as many times a day as you want. And so do this, and then I'm going to show you something else you can do with a tool that you can get on Amazon or Walmart really cheap. Okay, so this Theragun-like thing, I got this for 50 bucks on Amazon. It's by a company called Body Bay. They all look alike. They probably all work alike, so I would not spend $200 for one of these things. It comes with all the attachments, and we use these daily here at Physical Therapy, and we don't ever run the batteries down very often. So at home, one charge would probably get you a ton of use. But to use this at home, I would get in that same position where you cross your foot and you've got your hand at the base of your great toe, and you're really flexing that foot forward. Turn this on, and just the plantar fascia, like I said, it inserts kind of on the back inside part of your heel. And so I would just work this gun, and come with a variety of settings to speed it up to tolerance, and just work that tissue for a few minutes each day. This will definitely help complement the stretch that you're doing. It's almost like you're doing 2 in 1 here. You're doing that stretch I showed you previously, and you're working the gun on that tissue. It's not going to feel great, but just do what you can. I always tell my patients, a little discomfort, it means you're actually doing something. If I'm just kind of rubbing on this area and scratching, that may feel good, but it's not really accomplishing anything as far as getting rid of the plantar fascia. So just work that tight tissue for a few minutes each day with this gun, going back and forward, and just kind of transverse with the fibers, or right angle like that. It's useful, and see if that helps a little bit. All right, I'm going to show you another stretch you can do against the wall each day. So here we go. So if you're wondering in my treatment room about the art, this is my favorite treatment room. All the art in this room that you're going to see is for my kids, me and Gabe, and so this room always makes me smile, and the patients love it. So that's why we're in here. So simple stretch you can do each day. Again, you can do this several times a day. When my plantar fasciitis flares up, I usually do this 2 to 3 times a day, but find a wall or something that you can prop your foot on. You want to be on your heel, and you want your toes to bend backwards. So I always say, get those toes bent backward, and then put the heel on the ground. It's a great stretch for the calf and the bottom of the foot. Hold this 30 to 60 seconds. Another thing I like to do to stretch the other part of the calf. The calf is basically 2 muscles, the gastrocs, and then underneath the soleus. If you keep the same position and then relax your knee like you're lunging into the wall, you'll feel that stretch come on, usually a little bit higher, a lot of times in the Achilles tendon, but it's good to do both. So, get the straight stretch, hold for 30 to 60 seconds, relax the knee like you're doing a lunging motion like that against the wall. And again, both of these you can do a couple times a day and hold for 30 to 60 seconds and see if that helps. I'm also going to show you something you can do with a cheap device at home called a Pro Stretch. You can get them on Amazon for like 25 bucks. So let's check that out. Okay, so this is a Pro Stretch. I've had this for about 20 years here at the practice. They last for a really long time. They're also really cheap. Like I said, probably about $25 on Amazon. And to use this properly, just it's useful to have it close to a wall or someplace you can hold on to for balance. Just make sure that your heel is all the way back, okay? Come up on the Pro Stretch and keeping your weight over the device. You don't want to lean back or forward too much. Keep your weight over that and then simply allow your heel to drop. Let the toes come up and you'll feel the stretch, especially in your calf. But this does get the bottom of the foot as well. So again, starting position, and then slowly let that heel drop, toes come up until you feel that good stretch in the back of the heel. Hold this 30 to 60 seconds. You can do this a couple times a day and watch that plantar fascia pain go away. If this doesn't work, then you can come to the clinic or your local physical therapist and get things like dry needling. I find that a lot of people with plantar fasciitis, they have a rigid midfoot and a high arch. So this is not the population that you see with real flat feet. And so sometimes you can get orthotics for that, but there's also things you can do in the clinic to loosen up that tight midfoot. We call that joint mobilization. And I've even been known to do dry needling into the plantar fascia to kind of loosen it up from within. But anyway, I hope this helps and look forward to seeing you guys soon. Thank you.